Anytime someone's in the hospital or in a healthcare setting, it's overwhelming. There's lots of professionals in and out of the room giving different pieces of advice focused on their own area. And what we're wanting our students to do is clearly understand their area of practice, but also understand how do you work with other people. So our students are trying to look at a bigger perspective on how do we all fit together in a healthcare setting or in a team to provide the best outcome for the patient.
So our hope in social work and participating in the Interprofessional Education Program is that we're giving our students an opportunity to practice before they actually get into the field. And so they have an opportunity to learn about the other disciplines and be more knowledgeable practitioners when they enter the field. So if a person had a stroke and was in a hospital, the hospital social worker might first be there to provide emotional support for that person who has just experienced something that's probably very life-changing. We're also very cognizant of a patient's resources, what they have and what they don't have, and how that can maybe give them access to benefits or limit them. And so we're really concerned about the person and their environment, and so that includes their home, their family, other systems they're involved in, but really making sure that our patients can really get what they need.
So the role of the occupational therapist, if they were working with a stroke patient in the hospital, I always like to say we're experts in doing. So anytime an individual has trouble doing any activity, so maybe it's getting dressed, maybe it's weakness in their arm, or maybe it's cognition, maybe it's a loss of memory or processing skills, or maybe it's a loss of vision. All those are things that we would assess and then try to figure out how to treat.
When you think of a stroke patient, or really any neurological patient, and a dietitian's role, it's probably going to be related to, are they able to meet their nutritional needs, and also preventing other problems down the road. So if the patient has had a stroke, let's say, and isn't mobile, we don't want them to get a wound then or a bed sore on their leg because they can't move. So nutritionally, we'd give them different vitamins, minerals, protein, things like that to help their skin heal.
I hope my students will take away an appreciation for their professionalism, and that they're very passionate about their one program, about occupational therapy, but in the real world, it's all teamwork. It's all about each person bringing their piece of expertise to the patient. So in academia, they spend a lot of times with just other OT students, but the real world isn't like that, and they really have to learn to work together, to compromise, and to make the best patient outcomes.